What are the key principles of aseptic technique in veterinary surgery, and why is it critical to maintaining a sterile field during surgery? Answer: aseptic technique is a set of practices designed to minimize the risk of infection during surgery or medical procedures. The primary principles of aseptic technique include sterilization. All instruments, gloves, and surgical drapes must be sterilized before use. Sterilization eliminates microbial life from equipment to prevent post-operative infections. Antisepsis involves the use of chemical agents to reduce the microbial load on the skin, mucous membranes, or other tissues. Skin is typically cleaned using antiseptic agents like iodine or chlorhexidine before surgery. Barrier methods. These include wearing sterile gloves, gowns, and masks to prevent the transfer of microorganisms from the surgical team to the patient. Sterile field maintenance. The sterile field is maintained by using sterile drapes to cover the animal and ensuring all instruments and supplies are within the sterile field during the procedure. Failure to properly adhere to aseptic principles can result in post-surgical infections, which can lead to longer recovery times, increased veterinary costs, and complications that could endanger the animal's health. Explain the role of post-surgical care and recovery in veterinary practice and what are the key components that ensure a successful recovery for an animal following surgery. Answer: post-surgical care is a critical aspect of ensuring a successful recovery following a veterinary procedure. The key components of post-surgical care include monitoring. Continuous monitoring of the animal's vital signs, heart rate, respiratory rate, temperature, and blood pressure helps detect any signs of complications such as bleeding, infection, or shock. This should be done at regular intervals until the animal has stabilized. Pain management. Proper pain management is crucial to ensure the animal is comfortable and to minimize stress during recovery. Analgesics, e.g., NSAIDs or opioids, are typically administered to manage pain post-surgery. Wound care. The surgical site must be checked regularly for signs of infection or complications like dehiscence, wound opening. Nutrition and hydration. After surgery, animals may not have an appetite, so it's important to provide supportive care, including fluids, Roman or subcutaneous, and appropriate food to encourage recovery. Restricting activity. After surgery, animals may need to be confined to prevent them from licking the wound or engaging in excessive activity that could disrupt healing. Proper post-operative care ensures that the animal recovers without complications and is able to return to normal activity as soon as it is safe. Mr. Williams is working in a veterinary clinic and is asked to assist with a feline ovariohysterectomy, space surgery. He needs to prepare the sterile field and ensure the aseptic technique is followed correctly. What are the critical steps he should follow to maintain the sterile field during this surgery, and what are the possible consequences of not maintaining aseptic technique? Answer: in preparing the sterile field for a feline ovariohysterectomy, Mr. Williams should follow these critical steps. Preparation of the surgical area. Thoroughly clean and disinfect the table and surrounding area. Ensure that all instruments to be used, scalpel, scissors, forceps, etc., are sterilized. Lay sterile drapes over the surgery table, leaving only the area that will be operated on exposed. Verify that gloves, gowns, and masks are sterile before use. Sterile field maintenance. The surgical instruments should be placed within the sterile field, keeping them in a sterile tray or wrapper. Ensure that no non-sterile materials touch the sterile instruments, drapes, or field during the procedure. Personnel. The surgical team must wear sterile attire, gown, gloves, mask, and cap. Limit movement in and out of the sterile area to minimize the risk of contamination. Pre-surgery preparation. Clean the surgical site with antiseptic solutions such as iodine or chlorhexidine, ensuring proper sterilization. Ensure that the animal is adequately anesthetized and positioned. The consequences of failing to maintain aseptic technique can include infections at the surgical site, which could lead to complications such as sepsis, wound dehiscence, or prolonged recovery. This could increase the length of hospitalization, require additional treatments or surgeries, and negatively impact the animal's health. What is the difference between sterilization and disinfection, and how are these processes important in veterinary clinics? Answer: sterilization and disinfection are both methods of controlling microbial life, but they differ in their scope and effectiveness. Sterilization. This is the process of eliminating all forms of microbial life, including bacteria, viruses, and spores. Methods of sterilization include autoclaving, steam under pressure dry heat sterilization, and chemical sterilants. Sterilization is required for surgical instruments, implants, and anything that will come into direct contact with the animal's tissues during surgery. Disinfection. Disinfection is the process of reducing the number of pathogens to a level where they no longer pose a risk of infection. It does not necessarily eliminate all microbes, particularly spores. Disinfection methods are used on surfaces, non-invasive equipment, and areas where sterilization is not necessary. Common disinfectants include bleach solutions, alcohol-based products, and quaternary ammonium compounds. Both sterilization and disinfection are critical in maintaining a safe environment for animals undergoing surgery or treatment. Sterilization ensures that surgical instruments do not introduce harmful microorganisms into the animal's body, while disinfection helps reduce the overall microbial load in the clinic to prevent the spread of infection. Describe the key considerations when managing an animal in shock and explain how fluid therapy can be used to stabilize the animal's condition. Answer: shock is a critical condition that occurs when there is inadequate perfusion of tissues, leading to a lack of oxygen and nutrients to cells. The key considerations when managing an animal in shock include recognizing the signs. Signs of shock may include weak or rapid pulse, low blood pressure, pale or cool mucous membranes, rapid breathing, and lethargy. Initial assessment. The first step is to assess the severity of shock and identify the underlying cause, e.g. trauma, dehydration, sepsis. Immediate action should be taken to stabilize the animal, including providing oxygen therapy if necessary. Fluid therapy. The primary treatment for shock is the administration of fluids. The goal is to restore circulating blood volume, improve tissue perfusion, and stabilize vital signs. The types of fluids used depend on the cause of shock. Crystalloids. These are water-based solutions containing electrolytes, such as saline or lactated Ringer's solution. They are commonly used to treat hypovolemic shock due to fluid loss. Colloids. These solutions contain larger molecules like proteins or starches that help retain fluid in the bloodstream, making them suitable for conditions like hyperproteinemic shock. Blood products. In cases of hemorrhagic shock, blood transfusions may be necessary to replace lost blood volume and improve oxygen carrying capacity. Careful monitoring is essential to avoid overloading the animal with fluids, which can lead to complications like pulmonary edema. The amount of fluid to administer should be calculated based on the animal's weight, condition, and the cause of shock. What is the correct procedure for applying a bandage to an animal's wound, and why is it important to follow this procedure? Answer: the correct procedure for applying a bandage to an animal's wound involves the following steps. Clean the wound before applying a bandage. The wound should be cleaned with an antiseptic solution to remove dirt, debris, and bacteria. Apply a sterile dressing. Place the sterile, non-stick dressing over the wound to absorb any exudate and protect the tissue from further contamination. Wrap the bandage. Use a sterile gauze or bandage material to wrap the dressing securely. The bandage should be snug but not too tight, as it could impair circulation. Secure the bandage. Secure the bandage with medical tape or an adhesive strip to prevent it from slipping. Monitor the bandage. Check the bandage regularly to ensure it stays clean and dry and to ensure the animal does not chew or lick it off. Change the bandage as necessary to prevent infection. Proper bandaging is important because it helps to protect the wound from contamination, absorbs any drainage, and provides support to the injured area. A poorly applied bandage can cause further injury, impede circulation, or increase the risk of infection. Mrs. Taylor brings her dog to the clinic after the dog ingested a potentially toxic plant. What immediate actions should be taken by the veterinary technician to treat the dog, and what are the potential challenges in handling poisoning cases in animals? Answer: upon recognizing that the dog has ingested a toxic substance, the following immediate actions should be taken. Stabilization. The dog should be assessed for signs of shock or respiratory distress. If necessary, administer oxygen therapy or fluids to stabilize the animal before further treatment. Induce vomiting, if appropriate. If the ingestion was recent and the toxin is not caustic, vomiting may be induced to remove the substance from the stomach. Activated charcoal. If vomiting is not possible or effective, activated charcoal can be administered to absorb the toxin and prevent it from being absorbed into the bloodstream. Specific antidotes. Depending on the type of toxin ingested, specific antidotes may be required. Monitoring. The dog should be closely monitored for any changes in condition, including changes in heart rate, breathing, and neurological status. Challenges in handling poisoning cases include identifying the toxin, as many animals ingest substances from multiple sources. Additionally, the time of ingestion can significantly impact treatment outcomes, making early intervention crucial. What are the common signs and symptoms of animal medical emergencies, and how should a veterinary technician respond to them? Answer: signs and symptoms of animal medical emergencies vary depending on the cause, but commonly include Cardiovascular distress, rapid breathing, weak or rapid pulse, pale mucous membranes, and low blood pressure may indicate shock, bleeding, or heart failure. Neurological symptoms, seizures, disorientation, and unresponsiveness may suggest neurological issues such as head trauma or poisoning. Respiratory distress, labored breathing, coughing, or cyanosis may indicate respiratory distress or failure. Gastrointestinal symptoms, vomiting, diarrhea, or bloating may suggest gastrointestinal obstructions, infections, or toxins. In response to these symptoms, a veterinary technician should assess the animal's condition quickly to prioritize treatment, administer emergency care, CPR, oxygen therapy, or intravenous fluids, communicate with the veterinary team to provide appropriate diagnostics and treatments, monitor the animal's vital signs closely throughout the emergency. What is the protocol for handling a suspected case of rabies in an animal, and why is it critical to follow this protocol strictly? Answer: the protocol for handling a suspected case of rabies includes the following steps. Isolation. The animal should be immediately isolated to prevent contact with other animals or people. Rabies is a zoonotic disease, so preventing exposure is critical. Contact authorities. Notify local health authorities or animal control, as rabies is a reportable disease in most regions. Animal observation. In many cases, animals suspected of rabies should be observed for behavioral changes, aggression, excessive salivation, paralysis for a specified period, usually 10 days. Testing. In cases where the animal has died or needs to be euthanized, the brain tissue can be tested for the rabies virus using techniques like the direct fluorescent antibody test. Strict adherence to this protocol is essential because rabies is fatal to animals and humans. Prompt response and quarantine procedures help prevent further exposure and allow for accurate diagnosis and public health responses. Explain the importance of proper handling and transportation of injured or critically ill animals in a veterinary setting. Answer: proper handling and transportation of injured or critically ill animals are critical for several reasons. Prevention of further injury. Improper handling can exacerbate existing injuries, particularly in animals with fractures or spinal cord damage. Proper restraint techniques and supportive handling reduce the risk of making injuries worse. Reduction of stress. Animals in pain or distress can become agitated, increasing their risk of injury or making it difficult to assess and treat them. Gentle, calm handling can help keep the animal's stress levels low, facilitating easier care. Stabilization during transport. Injured or critically ill animals must be transported securely to prevent sudden movements. Using appropriate carriers or stretchers ensures they are transported safely and vital signs can be monitored during the journey. Emergency care during transport. Critical animals may need emergency care during transport, such as oxygen supplementation or fluid therapy. Transport should be arranged in a manner that allows the veterinary team to provide necessary care en route. Explain the role of the hypothalamus in maintaining homeostasis in mammals. How does the hypothalamus respond to changes in body temperature, and what physiological mechanisms are involved? Answer: the hypothalamus is a crucial brain structure in maintaining homeostasis, particularly in regulating body temperature. It functions as the body's thermostat by detecting changes in internal body temperature. When the body temperature deviates from the optimal range, typically around 37 deg in humans, the hypothalamus initiates compensatory mechanisms. Heat production mechanism. In response to cold, the hypothalamus triggers vasoconstriction to reduce heat loss and stimulates shivering, which generates heat. Heat loss mechanism. In response to overheating, it triggers vasodilation to increase blood flow to the skin, enhancing heat loss through radiation, and activates sweating to cool the body through evaporation. Its dynamic regulation of temperature is vital to the animal's survival and is an example of negative feedback mechanisms where the response works to counteract the initial stimulus, keeping internal conditions within narrow optimal ranges. Describe the process of mitosis and meiosis in animal cells and explain their significance in the growth and reproduction of animals. Answer: mitosis is a process of cell division that results in two genetically identical daughter cells. It is crucial for growth, tissue repair, and asexual reproduction in animals. The process involves several stages: prophase, metaphase, anaphase, and telophase, followed by cytokinesis. During mitosis, the chromosome number remains constant, ensuring that the daughter cells have the same genetic material as the parent cell. Meiosis, on the other hand, occurs only in the reproductive cells, gametes, sperm and egg, and results in four non-identical daughter cells, each with half the number of chromosomes haploid. This is essential for sexual reproduction, ensuring that when sperm and egg combine, the resulting offspring has the correct diploid chromosome number. Meiosis introduces genetic diversity through processes such as crossing over during prophase. Both processes play fundamental roles. Mitosis enables organismal growth and tissue regeneration, while meiosis contributes to genetic diversity and reproduction. Mr. Thompson is a veterinary technician working in a small animal clinic. He receives a cat with symptoms of vomiting and lethargy. The cat is in a stressed state and is difficult to handle. What steps should Mr. Thompson take to safely restrain and care for this animal, considering its welfare and minimizing stress? Answer: in this situation, Mr. Thompson should prioritize both animal welfare and safe handling techniques. The steps include assessment of the situation. Begin by assessing the severity of the cat's symptoms. If the cat is lethargic and vomiting, the first priority should be medical intervention. Minimize stress. Given that the cat is stressed, Mr. Thompson should ensure a calm environment, minimize loud noises, and avoid sudden movements. He should use slow, gentle handling and speak in a soothing tone. Restrain. The cat should be restrained using the least restrictive method necessary. The most suitable technique might be using a cat bag or towel to secure the animal while still allowing access for a physical exam. A scruffing method may also be useful in some cases, but care should be taken not to exacerbate the animal's stress. Physical examination and immediate care. A quick but thorough examination should be done to assess the cat's condition. If it is vomiting, Mr. Thompson should ensure the cat is kept in a position that allows it to clear its airway if necessary. Welfare considerations. Stress management includes offering hydration and warmth while reducing unnecessary handling. Describe the structure and function of the ruminant digestive system and explain how it differs from the digestive system of non-ruminant animals. Answer: ruminants such as cattle, sheep, and goats have a highly specialized digestive system designed to break down tough plant material, particularly cellulose. The main features include forked stomachs. Ruminants have 4 compartments: the rumen, reticulum, amossum, and abomasum. The process of digestion begins in the rumen, where microorganisms break down cellulose into volatile fatty acids and gases. Fermentation. The rumen serves as a fermentation vat housing bacteria and protozoa that help break down fibrous plant material. This fermentation process allows the animal to extract nutrients from plant matter that non-ruminants cannot digest effectively. Regurgitation, cud chewing. After initial fermentation, partially digested food, cud is regurgitated, chewed again, and swallowed for further digestion in the abomasum, the true stomach. In contrast, non-ruminants, e.g., pigs, humans, have a simpler digestive system with a single-chambered stomach. Digestion occurs in the stomach and small intestine, and these animals rely more on enzyme-based digestion rather than fermentation for breaking down food. What are the key indicators of stress in domestic animals, and what are some practical strategies for managing stress in a clinical setting? Answer: stress in animals can manifest through various physical and behavioral signs, including physical indicators: elevated heart rate, rapid breathing, increased salivation, muscle tension, dilated pupils, and changes in posture, e.g., crouching or avoidance. Behavioral indicators: restlessness, aggression, hiding, excessive grooming, vocalization, and attempts to flee. To manage stress in a clinical setting, the following strategies are recommended. Environmental control. Keep the environment calm by reducing loud noises, bright lights, and unfamiliar scents. Using calming pheromones or music can help reduce anxiety. Gentle handling. Use slow, deliberate movements and minimal restraint. Always prioritize the animal's comfort and ensure its welfare during procedures. Familiarization. Allow animals time to acclimate to the clinic environment. If possible, handle the animal in a familiar space before procedures. Stress reduction techniques. In cases of extreme stress, medications such as sedatives or anxiolytics may be prescribed by a veterinarian. Explain the process of oogenesis and the hormonal regulation involved in the female reproductive cycle of mammals. Answer: oogenesis is the process of egg cell development which takes place in the ovaries of female mammals. Oocyte development. Oogenesis begins before birth, with oocytes, immature egg cells, being formed during fetal development. These oocytes remain in a dormant state until puberty. Follicular development. During the reproductive cycle, several follicles in the ovaries begin to mature, but typically only one will fully mature and release an egg. Ovulation. This process is hormonally regulated by follicle-stimulating hormone FSH and luteinizing hormone LH, both secreted by the pituitary gland. Ovulation and hormonal regulation. The maturation of the dominant follicle is driven by FSH, while the surge of LH triggers ovulation, release of the egg. After ovulation, the empty follicle transforms into the corpus luteum, which produces progesterone to maintain the uterine lining for potential pregnancy. If pregnancy does not occur, the corpus luteum degenerates, leading to a drop in progesterone levels and the start of the next cycle. Discuss the difference between manual restraint and mechanical restraint in animal handling. Provide examples of situations where each type of restraint might be appropriate. Answer: manual restraint involves using the hands and body to restrain an animal. This technique is often used for small animals or for procedures that require a quick and gentle approach, such as during a physical exam. Examples include using a scruffing technique in cats or hugging a dog's body to prevent movement during injection administration. Mechanical restraint uses tools or devices to physically limit an animal's movement. These include cages, muzzles, or animal restraint bags. Mechanical restraint is often used for larger or more aggressive animals, or when manual restraint would be unsafe. For example, muzzles are used in dogs that might bite, while a collar might be used to prevent animals from licking surgical sites. Both methods should prioritize the animal's welfare and be employed in a manner that minimizes stress and discomfort. Describe the role of mitochondria in cellular metabolism and explain how mitochondrial dysfunction can lead to diseases in animals. Answer: mitochondria are the powerhouse of the cell, generating energy in the form of adenosine triphosphate through oxidative phosphorylation. This process involves the electron transport chain and chemiosmosis, utilizing oxygen to produce ATP from glucose. Mitochondria also play key roles in calcium regulation, apoptosis, programmed cell death, and the production of certain hormones. Mitochondrial dysfunction can lead to a variety of diseases as ATP production is compromised, affecting all energy-dependent cellular processes. In animals, mitochondrial diseases can result in symptoms such as muscle weakness, neurological deficits, or organ failure. One example is mitochondrial myopathy, which causes progressive muscle weakness due to impaired mitochondrial function in muscle cells. What are the key considerations when designing an optimal environment for laboratory animals, and how does this impact animal welfare? Answer: designing an optimal environment for laboratory animals involves considering the following factors: temperature and humidity. Different species have specific temperature and humidity requirements that must be met to maintain health and comfort. For example, rodents typically require temperatures between 18° and 24°. Space and enclosure size. Sufficient space allows animals to exhibit natural behaviors, reducing stress. Crowded or inadequate enclosures can cause physical and psychological harm. Light and dark cycles. Many animals require specific light-dark cycles to maintain normal circadian rhythms, and failure to provide this can cause stress and affect health. Environmental enrichment. Providing objects like toys or nesting materials can reduce stress and improve mental well-being. By considering these factors, researchers ensure that the welfare of the animals is not compromised, which is essential for ethical research and accurate results. What are the signs of pain in animals, and what should a veterinary technician do if they suspect an animal is in pain? Answer: signs of pain in animals can include physical signs, changes in posture, e.g. crouching, limping, increased heart rate, labored breathing, and reduced movement. Behavioral signs: restlessness, aggression, vocalizations, and reluctance to eat or drink. Changes in grooming habits. An animal in pain might neglect grooming, leading to a matted coat or unkempt fur. If a veterinary technician suspects an animal is in pain, they should assess the situation, conduct a thorough physical examination, and observe behavioral changes. Administer pain relief. Depending on the severity, provide appropriate analgesics, e.g. opioids, NSAIDs, as prescribed by a veterinarian. Monitor the animal. Regularly check the animal's response to pain relief, adjusting treatment as needed. By recognizing the signs of pain early and acting quickly, the technician ensures the animal's comfort and prevents long-term suffering. What are the primary differences between bactericidal and bacteriostatic antibiotics, and how does each classification affect the treatment approach for bacterial infections in animals? Answer: bactericidal antibiotics directly kill bacteria, while bacteriostatic antibiotics inhibit bacterial growth, allowing the animal's immune system to eradicate the bacteria. The choice between these two types depends on the nature of the infection. For example, bactericidal antibiotics, such as penicillin, are typically preferred for severe infections where rapid bacterial eradication is needed, such as sepsis. On the other hand, bacteriostatic antibiotics, like tetracyclines, are used for less severe infections where the immune system can effectively handle bacterial elimination. From A treatment perspective, bactericidal drugs are often used in immunocompromised animals, as their immune system may not be capable of fighting the infection on its own. In contrast, bacteriostatic drugs are often used when the infection is not life-threatening and the immune system is expected to resolve the infection. Why is it important to differentiate between the nutritional needs of herbivores, omnivores, and carnivores when formulating their diets, and what could be the consequences of not doing so? Answer: different species have specific enzymatic and metabolic systems that dictate how they process and utilize different nutrients. Herbivores, such as cows and horses, require diets high in fiber for digestion in their specialized digestive systems and low in animal protein. Carnivores, like cats and dogs, need protein and fat from animal sources as their digestive systems are adapted to process these macronutrients efficiently. Omnivores, such as pigs and humans, can digest both plant and animal-based foods, requiring a more balanced diet. Failure to meet the specific nutritional needs can lead to malnutrition, growth stunting, or even death. For example, feeding a carnivore an exclusively plant-based diet may result in protein deficiency, while feeding an herbivore a diet too high in protein may lead to kidney damage. The AAFCO, Association of American Feed Control Officials, guidelines stress the importance of formulating diets that meet the species-specific nutritional requirements to prevent such issues. What are the common signs of calcium deficiency in a lactating dog, and what are the potential consequences if it is left untreated? Answer: calcium deficiency in a lactating dog can present as muscle tremors or spasms, tetany, weakness or lethargy, decreased appetite, severe cases, seizures or collapse. If untreated, a calcium deficiency in a lactating dog may lead to eclampsia and milk fever, which can be life-threatening. Eclampsia occurs due to a significant drop in blood calcium levels during lactation, leading to symptoms like muscle rigidity, convulsions, and difficulty feeding puppies. It can be managed with calcium supplementation and careful monitoring. What are the primary differences between commercial and homemade animal feed, and how do they impact the nutritional balance of the animal? Answer: commercial animal feed is carefully formulated to meet the nutritional needs of animals, with standardized ingredients and guarantees for protein, fat, fiber, and vitamins. It often contains preservatives, stabilizers, and other additives to enhance shelf life and palatability. However, some animals may not tolerate certain preservatives or artificial additives. Homemade animal feed, on the other hand, can be tailored to the specific needs of an individual animal but requires careful planning to ensure it is nutritionally complete. Homemade diets may lack certain vitamins and minerals, leading to nutritional imbalances if not formulated correctly. For example, feeding a homemade dog diet without proper calcium supplementation can lead to osteoporosis and skeletal issues. Regulations such as the AAFCO guidelines are intended to ensure that commercial feeds are nutritionally complete. For homemade diets, a veterinary nutritionist's guidance is often necessary. Mr. Davis works at an animal clinic and is responsible for administering medications to a cat named Whiskers. He has been instructed to give Whiskers 0.5 ml of medication daily for 5 days. On the third day, he accidentally administers 1.0 ml of the medication instead. What should Mr. Davis do in this situation, and how should the medication error be documented? Answer: Mr. Davis should immediately notify the veterinarian about the medication error and seek further guidance on any necessary action, such as monitoring for adverse effects. The error must be documented in Whiskers' medical record, including the date and time of the incident, the error 1.0 ml administered instead of 0.5 ml, any potential effects on Whiskers' health, corrective measures taken. According to the Veterinary Surgeons Act and clinic standard operating procedures, medication errors should be reported promptly to ensure patient safety in compliance with legal and ethical standards. All staff should be trained in medication administration and error reporting protocols to minimize risks. How do drug interactions affect the pharmacokinetics of a medication, and what precautions should be taken when prescribing multiple medications to an animal? Answer: drug interactions can alter the pharmacokinetics of a medication, affecting its absorption, distribution, metabolism, or excretion. For example, a drug that inhibits liver enzyme G-cytochrome P can slow down the metabolism of another drug, leading to toxicity. Conversely, a drug that induces these enzymes can increase the metabolism of another drug, reducing its therapeutic effect. Precautions to take include reviewing the animal's full medical history for any pre-existing conditions or concurrent medications, monitoring drug levels in cases where interactions are likely, consulting with a veterinary pharmacist or the prescribing veterinarian to ensure drugs are compatible. The veterinary medicines regulations require that drug interactions be carefully managed to avoid adverse effects. Why is a high-protein, low-carbohydrate diet often recommended for sick cats recovering from surgery, and how does this affect their recovery process? Answer: a high-protein, low-carbohydrate diet is recommended for sick cats recovering from surgery because cats have a high protein turnover and require increased amino acids to support tissue repair and recovery from surgical stress. The low-carbohydrate content helps to reduce the risk of hypoglycemia and insulin resistance, which can occur in cats with underlying conditions like diabetes. The AAFCO guidelines recommend feeding critically ill or post-surgical animals diets that are high in quality protein to support immune function and wound healing. This type of diet helps cats recover faster by promoting cell repair and maintaining muscle mass. Compare the benefits and limitations of administering medication via the intravenous route versus the oral route in small animals. Answer: the IV route provides the fastest onset of action, allowing the drug to enter directly into the bloodstream, which is critical in emergencies or for drugs that require rapid therapeutic effects, e.g. anesthesia. However, it can be technically challenging and is more invasive, requiring skilled personnel and appropriate sterile techniques. The oral route is easier, non-invasive, and generally more convenient for long-term treatment or outpatient care. However, its onset is slower as the drug must first be absorbed from the digestive tract, and its effectiveness can be influenced by factors such as food intake or gastrointestinal health. The choice of route depends on the urgency of treatment, the drug's pharmacokinetic profile, and the animal's condition. What are the potential renal and hepatic risks associated with administering NSAIDs, non-steroidal anti-inflammatory drugs, to a dehydrated animal, and what precautionary measures should be taken when using these drugs? Answer: administering NSAIDs to a dehydrated animal can lead to renal failure due to the drug's potential to reduce blood flow to the kidneys, especially in animals with pre-existing kidney disease. NSAIDs inhibit cyclooxygenase (COX) enzymes, which are involved in producing prostaglandins that help maintain kidney function, particularly in conditions of dehydration. Hepatic toxicity is also a concern, as NSAIDs are metabolized by the liver, and the liver's ability to process these drugs may be compromised in stressed or compromised animals. Precautionary measures include ensuring proper hydration before administering NSAIDs, monitoring renal and liver function through blood tests, selecting NSAIDs with fewer side effects, although specifically designed for animals, such as carprofen, which has a safer profile for use in veterinary medicine. The veterinary medicine's regulations require thorough monitoring when using NSAIDs, particularly in vulnerable animals. What is the impact of a high-fat diet on the overall health of a dog with pancreatitis, and how should its nutritional plan be adjusted to prevent exacerbation of the condition? Answer: a high-fat diet can significantly worsen pancreatitis in dogs. Pancreatitis occurs when the pancreas becomes inflamed, often due to high-fat food, which stimulates excessive release of digestive enzymes. These enzymes can then damage the pancreas itself, worsening the inflammation. For dogs with pancreatitis, the dietary plan should focus on low-fat content to reduce the stimulation of pancreatic enzymes, easily digestible carbohydrates such as rice or sweet potatoes, high-quality protein sources like lean chicken or turkey to support recovery without overloading the digestive system. The American College of Veterinary Nutrition (ACVN) recommends that dogs with pancreatitis consume prescription diets that provide balanced nutrition but minimize stress on the pancreas, ensuring safe recovery.